today on the health segment, of course, you know that it's Pink October, and so we're focusing heavily on this challenging thing called breast cancer. And of course, we're going to be looking at breast health in female children. Today we've been joined on the show by Dr. Annie Owusu. She's a pediatrician and a deputy, in the Department of Child Health in Kolebu Teaching Hospital. Of course, we experience her better half most of the time on the show this morning. So she's here to give us the better side of life. Annie, how are you?
Hi, David. I'm fine.
So
the better side.
Yeah, the better side. Yes, we like that. Yeah.
Nice.
So how are you doing?
I'm well. How
Good,
are
good,
you?
good. Very good to have you
Good to be
here.
here again.
Yeah. All right. So let's get right into this conversation. Breast health. I wouldn't have thought that for children. Is there anything, it's like it's when you get older that you start to get concerned about things like that. But is there any reason for concern in children?
Well, we were thinking before you guys get all caught up in the dark side, which is the breast cancer and all the things and what the awareness is all about, maybe we should start from when they develop.
Okay.
So oftentimes it's not something we think about. Like you said, it's when there are issues in older life, but then there are still some things that we need to know concerning the girl child and her developing breast before she becomes a woman. So that's why this is the starting.
Good.
Yeah.
So let's get into it. Tell us.
So basically, before we get to the stage where we are talking about adults, breast cancer and all that, in children it's not a common thing. Indeed, we are seeing breast cancer earlier than we should be seeing. So we are seeing late teens and 20s when before they were much older. But younger, maybe under 18, it's rare. But then the concerns are with maybe breast development and how to sort of make the girl child confident about her body, because again, in our culture, breasts are things we don't talk about. Our bodies are things we don't even talk about. So most girls, if they had issues, they would not even approach anybody. And most mothers, first time, would pick things that their mothers did to them and then pass it on. Because I remember some of the things that were made to do growing up when your breasts start developing, they could tie and things.
I know, right?
Exactly. So some of these things need to be talked about because we've come a long way. Some of these things need to be left behind. So yeah. So typically, most of the things are genetically pre-programmed for breast development, because you are programmed as a girl, you're born as a girl. The development has already started whilst you're in your mother's womb. And then as you grow, when the hormone changes occur, then the development starts. But let me even start from the infants. I know some people would see an infant child, both males and females, with breast. It's a cause for concern. Why is my child having breast? I just gave birth to this child, is 1 month old, has breast. But then there's some passage of hormones from across the placenta, from the mother to the baby. So some babies are born, and then within the first month, they may have a bud that looks like they have breast. And they may even discharge milk. And sometimes the mothers will come, they are so worried. Sometimes things would have been done. They've applied some herbs and stuff on it. But let me start from there. There are normal things that occur. And they usually, if left alone, within about 6 weeks, most of it will regress. If it persists beyond 3 months, then we start sort of paying attention. By 6 months, then we need to do some investigations to see what's causing the problem. But most newborn babies will have a breast bud, which will regress as they grow up. So that's the initial stage of the breast issues. Then as the girl, then we leave the boys behind. As the girl child is growing, by about 8 years, the first sign of puberty in girls is the development of breast, which will start between age 8 and 12. Again, determined by your genetics, determined by your nutrition, and all sorts of other factors. Because our mothers will tell us that now the developments are occurring at a younger age compared to before. So the environments are different, the diets are different. So by about age 8 years to about 12, the breast starts developing. Typically, menarche, which is the start of the menstrual period, will develop about 2 years after the first sign of the breast development. So the first sign of puberty is the breast, and within 2 years, you see the menarche will occur. So if the child develops breast around age 8 years, maybe by 10, 11, they should be having their menses. So these are some of the things. And typically, the first sign of breast development is sometimes the tenderness is painful. So you see that girls, they are growing up and they stop playing with their peers in school as they used to, because then the boys don't understand and everybody is doing rough play and hitting them. So it's quite tender when the bud starts developing. The bud is just, maybe it's like a 20 peso coin, disc shape, very small, but can be quite tender. And the whole of the breast and its architecture is going to develop from that bud. Meanwhile, this is the same bud that they tell us that when it comes, you have to go and bust it with something so that, you know, so it can be quite painful. And then you're asking this poor girl who doesn't even understand what's happening to her body to do some of these things. And a few people would start getting it, and then it sort of regresses because the hormone levels are not consistent yet. So it regresses, then it starts developing again. But then it becomes consistent. And oftentimes it may be just one, and it's not a problem. And the other one will catch up eventually.
So if, for instance, I have a daughter, right? At what point do I have to start paying particular attention to her breast health? In fact, that is if everything appears normal. So at what stage do I need to now pay attention to her breast?
So I would say right from when she can understand that she's a female and her body is different from the males, because you have to start prepping her before maybe the breast starts developing, because you would have noticed that mommy has breast, mine is flat. Why? Some of them, they are curious, will ask you questions. So then you have to preempt them that maybe by the time you are 8, 9, something will start developing. And then when it's, so you create an environment where they can't talk to you. So when it starts, then they don't go hiding, they can come and tell you. And typically there's nothing much you need to do actively except to encourage. It's a bit painful, it takes time. Sometimes it's so tender that they don't even want to lie on their tummies, they want to lie on their backs. But then it passes. And then oftentimes they don't need support at that stage because it's just a bad, but they, you realize that sometimes when they wear padded trainer bras, it's less tender, especially when somebody hits or you hit against something. So you start a conversation before they get there, and then when they get there, you just support them along. It's more of a psychological support than anything physical that you would do, because most people will have normal development without issues.
You sometimes notice that young children, but they are very busty. You know, is it like genetics? Is it, what really accounts for that, and how do you handle that?
Okay, so it can be like I was saying, the breast development can be have quite a psychological influence on them, make them more conscious, especially when they seem to develop way ahead of their peers, and then when they are lagging behind as well. So again, it's determined by genetics, diet, and even body fat composition. So some people will develop breast earlier just because maybe they are obese. So that's fat tissue, and then the fat tissue and conversion to estrogens and all of that. So if they have a good weight, good diet from the beginning, they should fall within the normal bracket of development. But the size and how fast it progresses will be determined by genetics largely. And sometimes not even the genes of the mother, because the father doesn't breed, but then you see your child, they are taking from the other side. Exactly. So it's more of support. And before, when we were growing up, it sort of looked like a child didn't wear a bra. So nobody pays attention to help support them. But these days, I think we are becoming more aware, and then we'll help with that. Because me, for instance, I was into sports, an athlete. I started developing breast, and I was just sort of going, and then I had a sprint one day, and then one of my teachers said, I ran fast, except that my breasts were holding me back, and it made me so self-conscious. I never did it again. But if I had maybe support, and I had supporting or sports bras, then I could have gone further with that. So it makes them self-conscious, so we don't add to that further, you know. So it's not like, okay, a child is 10 years and you see that her breasts are developing quite fast and she needs a bra, you're thinking, well, she's too young, so let's wait till age 13. Then she's more self-conscious.
So give us a practical process. So for instance, my daughter is now 10. I'm beginning to see maybe the buds are coming and all that. What conversations do we have to have? How do I help her, you know, in terms of underwear and stuff like that? What do we have to do?
Okay, so the training bras are quite helpful. Like I said, they are very comfortable for the discomforts that they have in the initial stages, and it's not dependent on the size initially, it's just dependent on comfort, and also to give them some privacy, I mean, and all of that, making them feel like they're a bit more adult. So they get excited with the training bras and all of that, and you need to be conscious to change it when eventually they do need size support. So it will be an ongoing conversation. Okay, what do you need now? Let's go shopping. Let's see if we can get you something. You pick something that's on their favorite color, like pink. So you start a conversation, and then you create an avenue where they don't have to be shy, and then they talk to you. Sometimes we even have to go back and talk to some of their siblings, especially the boys and other people, to sort of respect the fact that the girl has come to the stage and then you need to give her some privacy. And then for underwear, cotton, something that doesn't scratch, something that doesn't cause a reaction with their skin should be helpful. And then the usual body skin care and all of that should be fine.
So when we are home, how should the conversation be? Because we are people who normally we feel, you tease people, but you feel we are just playing with you.
Exactly. We do that a lot.
And girls are now beginning to open up to embrace themselves. How should a conversation be when you have like maybe a 10-year-old, a 12-year-old who is now beginning to develop breasts, especially when she is just one girl amongst guys, so she's the only person. How should home be like? The conversation.
So again, not to make it too different so that it becomes so obvious that something is different. You just sort of ease it in as part of growing up. So it's how do I put this? It's not like we're going to be intentional, but make it look like it's a natural conversation so that she's not self-conscious the more. And again, if growing up you sort of set the stage for conversation, it shouldn't be too difficult to have a conversation. And if it is one girl among guys, then a lot of mommy time will help. So if you decide to hang out with her, you are doing something with her, you just have a conversation, like normal conversation. Because when you want to call people aside to have a conversation, then they also get
like a special case.
Exactly. So it shouldn't be so different that it makes her feel different, but it should be had some way, somehow. Just like you have sex education conversation. If you don't have it, they'll come and ask you the questions when they have it in school. So you sort of have to make it look like it's a normal thing, but be still intentional about it. I don't think it should be that mysterious. And I don't have a formula per se, but it depends, and it depends on the child's age and then level of development. 2 10-year-olds may be very different in their level of understanding. So you have to gauge that and then see what to say when, and then ease that in.
Wow. Very interesting. Yeah, I mean, they do say that having daughters is quite different from having sons. It's a different experience. And I think you're very blessed if you have both. So you can have, see both experiences. How is it like for you?
Growing up?
No, I mean, with like your kids at home.
They're still quite young.
Okay, so we haven't got into
right now we've not done they're talking because they go to school and they go and let them say, you can't really sit in the car. They ask you also some questions that you haven't prepared for, like what is rape, what is this? I'm like, oh my God, I just started already. And they're 7, 6, so schools are doing it. So if you don't do it, then it sort of catches you by surprise, because they ask the question, you're like, okay, how do I go about this? And then you have to sort of, but like you said, it's an experience having both, so you know that. But at the younger ages, somehow the differences are not too much, yes. But when they start getting into adolescent, 9, 10, then you start to see the segregation of caring.
Wow. Generally speaking, for ladies, for young ladies, at what point do you feel that you must definitely start doing things like breast checks regularly?
So when the breast goes through stages of development to adult side, there are about 5 stages from when the bud appears to when it's for adult side. By the time they're starting their menarche, that's the menses, it's about stage 2, stage 3. Then once the hormones start being produced, the adult stage progresses after that. So by the time they start their menses, then it will be a time to have the conversation about checks, because even though we talked about cancer in older age groups, there are some lumps that may happen in the young girls, what we call the fibroadenomas. They are benign, but they are there. And if they examine, they will notice they are there. And sometimes if it gets bigger to the point that it distorts the architecture, so one is obviously bigger than the other, sometimes it needs to come out. So they also will need to have the check. So all children should actually have all child visits to pediatricians. I'm being an advert for myself. Is necessary? So it's not always when they are sick. So even yearly, especially in the transition periods, teenagers, adolescents, so that some of these things can be checked.
I think we should even normalize going to the doctor. It's not because you're sick. It's normalized.
I think because of our
checks.
patient to doctor ratio, we don't do that because it means long waiting hours and things. But that's where it's part of the thing.
Like, why are you going? Because after all, you're going to wait a long time.
Exactly.
And sometimes poverty.
I know. Dr. Adi, thank you very much for coming through. Are you on social media?
Yes, I
Can
am.
people reach out to you if you have any questions?
Yes,
Okay.
yes, yes.
What do you-
Anyusu
Anyusu.
on Facebook. That's where I go often when I go.
Okay.
All right.
All right.
Fantastic.
Thank you.
All right. So we'll be speaking with Dr. Annie Owusu, a pediatrician with the Department of Child Health in Kolebu Teaching Hospital.